Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Welcome to the ZOOMERTIMES TV presentation. We have a star interview. Of course, it's Mike Rozenblum, and Mike is a chiropractic physician, but he's more than that. He is a person, he's like the angel you've been waiting for to help you with your chronic pain in your knees. I know so many people who walk with a walker. They can hardly walk. They don't go out anymore. And when I found Mike, I said, oh my goodness. And he actually showed me what he does. So welcome to our show, Mike. I am so happy to have you with us. I just can't wait for people to try what you do. You're very, very good to do this for people.
Thank you. Thank you. It's a tremendous amount of pressure to be referred to as an angel, especially today, but
well,
we're going to try.
You deserve it. Tell us the history of how you found this, because you've been a chiropractor, and I'm sure you've met people in pain and you didn't know what to do for them with this.
Yeah, absolutely. I mean, I've been in physical medicine and chiropractic practice for it's nearly 30 years, 28 and a half years. Unbelievable. I can't believe it. But it's always been an issue of trying to identify, first of all, the source of the problem. Where's the problem coming from? And then what can we do from an alternative standpoint to be able to correct the problem? And so for us, when we got to a situation where a patient, particularly as it pertains to the knees, right, we're specializing and becoming more and more focused right now on the treatment of knee pain, chronic knee pain, not a brand new injury that happened last week, but something that's been affecting the quality of life of a patient for a number of years. And when it got to the point where the knee problem was bone on bone, it became almost an automatic referral out to someone with the idea that perhaps a surgery such as a knee replacement would be in place. And we're so delighted to now be able to offer an alternative for people that are suffering from this type of ailment. But it's not just an ailment, it's an impedance. It's people who suffer from chronic knee pain know better than anyone else. You can't get around, you can't move around, you can't walk properly, you can't kneel, you can't climb stairs, you sit for a little while, it's difficult to get up. And so we stumbled upon this treatment looking for a better way. And by we, I mean a group of doctors around the country that have put together this protocol.
Okay, I'm going to have you discuss exactly what it is in a moment. Let me give your phone number. So folks, it's interesting. Nowadays, you can literally go to a doctor like this for a consultation, and the consultation is actually your way to find out what's happening. He will make the time for you, and his phone number is, remember, this is ZOOMERTIMES information. So you want to write this down on a good book somewhere, a pad somewhere where you won't lose it. Ready? It's 954-977-0888. Correct, Mike? Is that right?
That's correct. That's correct.
Do it again, 954-977-0888. And his name is Mike Rozenblum. And it is absolutely the right person. His office is in Fort Lauderdale, but he'll talk to you on the phone first. He'll answer some of your questions. So why it's not going to be anything to hurt you. So let's ask Mike, what is this? Do you have to go in and get strapped down, and is in this a cold, hot room? You know, is this merciful? What is this?
Well, actually, it's a very exciting visit for us. So much so that when we schedule a knee consultation, we reserve all of our time and all of our focus and attention to be able to identify one thing only. Is the person in front of us a good candidate for treatment? That's really the main thing that we're trying to find out. And how we determine that is very simple. After completing some very precise and intentional paperwork, some questions. How long has the problem been there? A little bit about the history. We certainly want to know how this impacts and affects the quality of a person's life so that we can understand from a more comprehensive standpoint what our goals really are, other than just getting rid of the pain. If a person wants to just get rid of pain, I'm sure they can take enough pain pills and the pain starts to go away.
Right.
That doesn't mean that they're correcting the nature of the problem. And so for us, the idea is to, after a good history in consultation, begin by taking an x-ray, a standing digital x-ray, so that we can evaluate a few things about the knee joint. Number one, the space in between the two long bones of the leg. We want to know, is it bone on bone? If it is bone on bone, how much so? There's certain qualifications and categorizations of knee decay or arthritis or degeneration. So we're going to look at an x-ray that is real time in order to be able to assess what's happening regarding the condition of the space and also the alignment. Sometimes the knee, which is a relatively simple joint, it's like a hinge. The only thing the knee does is open and close. It's a very, very simple joint in terms of its mechanics. But if there's twisting, if there's misalignment, if the muscles, there are about 12 muscles that control the function of the knee, if they are out of sorts, then the hinge, the knee joint, is not functioning well. And so we'll do that. We'll do an evaluation to determine the function of that. And then the most exciting part of the entire visit is the test treatment, because after approximately 8 to 10 minutes of the test treatment, we'll be able to know with certainty whether or not a person is a good candidate for our program. Never before have we been able to do that in our physical medicine and chiropractic offices, to look at a patient and say, I know how you're going to do a month from now. And now with our knee program, because of the number of visits that we have seen across the country with associated clinics, we know who is a good candidate immediately after the test treatment. 100% of the patients that we accept for care will experience an immediate 10 to 15% improvement right away. And it sounds almost too good to be true, but in all fairness, if a person does not experience an improvement immediately after the test treatment, then that means that unfortunately they might not be a good candidate for care. So this doesn't mean that we can help everyone, but those people that we accept, we feel very, very confident that they're going to experience wonderful outcomes and results.
Mike, that was excellent, but I have a question about this. And when I did talk to this friend who I was urging her to go see you, she said, it won't help, I have bone on bone. So I didn't quite know what to tell her. What exactly does that mean? And why would your system not work? It sounds like it would work.
Our minds, sometimes we think that with our minds, we understand the entirety of a concept. So sometimes when you or I say bone on bone, without wanting to be offensive, our uneducated mind might say, well, bone on bone means there cannot be any progress or repair. And that's simply not accurate. Our actual experience, our clinical experience has been that the patients that are the most bone on bone can oftentimes experience the most relief. Now, let me explain. If a person is, say, in their 70s, maybe even early 80s, and they have an advanced degenerative problem in their knees, and they are what we would refer to as bone on bone, our treatment, our non-invasive treatment of knee decompression to open up the space in between the two joints, our muscular treatments, our technology utilizing LED technology, LED therapeutics, all of these treatments that we implement don't require for us to restore that joint to its original shape and function. So oftentimes, if you're really badly bone on bone, a 10, a 20% improvement would feel like 1,000% improvement, because there's so much irritation on the space that if we can improve things by just a little bit, the patient will experience a tremendous improvement in pain and function, which are the two things that we really are after. So the people that we have actually found the greatest difficulty with are the ones that don't have a lot of degeneration. they have a lot of inflammation, they've got instability, they have other factors that contribute to the inflammation in the area. Those are complicated cases. But I encourage anybody watching this show or any of your readers, the more advanced the degeneration, the more interested we would be in seeing you in our office to see if we can change the quality of your life. Because even this week, we had a patient who just couldn't believe it. After her test treatment, we were hoping for 10% improvement. She said, it feels 90% better. And so she says, this can't be true. I don't want to do anything until tomorrow. I want to sleep on this and I want to see what this is really about. She went home, she slept on it. She came in the next morning and she just joyfully and gladly signed up for care. And she's been one of those cases that if everybody responded like her, it'd really be amazing. But she's just gone from better to better to better inside of only probably 5 treatments. So it's an incredible thing. We can't control the healing rate of people, but we certainly can tell after our test treatment who is going to respond favorably and who's going to not respond favorably. And we try to be very sincere with our expectations. We want to set the proper expectations. If somebody's bone on bone, this doesn't mean that you're going to be able to now run marathons. We have to be realistic. A person's body type, their prior history, their overall health, all of these are associated factors. But when it comes to being able to get your movement back, your life back, without surgery, without injections, it's certainly worth, I think, the price of admission to have this consultation exam, which includes the test treatment.
This brilliant physician is Mike Rozenblum. And Mike has his practice in Fort Lauderdale. His phone number, I'm going to give that to you again. Please get your pad out. You don't want to lose this because you want to make that call. It's 954-977-0888. Now, you do have a website, of course, also, and people can go onto your website, but I think it's better to make that phone call because then you will get to talk to Mike directly. I mean, this isn't a doctor you're going to have to go through 5 people to finally get a hold of him. If he hears that you're one of the people who responded to this interview or to the advertising, he's going to get right on this because he's very anxious. You can hear how anxious he is to help people. This is why he does this. Mike, I was thinking, and I told you this, that my husband is deceased now, but he had two knees done at the same time, and you can imagine. And it was a long process. He eventually was okay, but it was probably a year and it was very difficult. And if he had this opportunity, of course, this was like 7, 8 years ago or 10 years, I don't remember. What a joyful thing it would have been for him. I'm a wife who can really applaud you. Oh my goodness. You people, please take the chance. There's no chance. He's not going to do any cutting. He's not going to do anything. He's just going to do his exam. And he said, he'll tell you if he thinks it's good for you. If it's not, he doesn't want to do it because he's very success oriented. And I know him. So Chris, Mike, excuse me. I was thinking about something. I have a friend that's named Chris. And he actually, he lives in Georgia. And he used to live here. And he received the e-blast, the shout out. Why are you sending that to me? I already had knee surgery, hip surgery, everything. I said, well, we just sent it out to everyone. Maybe you know someone, because he suffered for probably 3 or 4 years and it made him look so old. He was bent over and he wasn't that old. He was in his 60s. I think he actually even looked for a job and people didn't want to hire him because he was so bent over.
Wow. Yeah, we have, there's a time and a place for surgery. We are not ignorant to that fact. I personally believe that oftentimes surgery ought to be the last resort, for obvious reasons, not even factors pertaining to the surgery in and of itself, but other associated factors such as anesthesia, the risk of infection, There are a lot of good reasons why, if we can delay or forego a surgery, uh, uh, then that's probably, it's a philosophical thing. I think that there are some patients who say, boy, give me as much prescriptions as possible, and I want to do as many surgeries as I can. I call them professional surgical patients. If there's a procedure, if there's a procedure that you can get done, they want to get it done. And I think that's fantastic. And we live in a country where we have probably the best medical care in the whole world. However, there are those people who are sort of surgery averse. If it can be done naturally, if it can be done with the least amount of risk or complications, they prefer those options. And we've actually treated some people successfully who've had knee surgery, who've had a meniscal repair or even a knee replacement, and things haven't worked out the way that they wanted them to. And we're so happy to be able to offer reasonable relief. This is not the cure to all of the world's problems, but it may be the proper protocol and treatment plan to help a person that might be watching this regain a little bit of the quality of life. Being able to get around is something that many of us early on take for granted. We feel like, well, it's just what we do. And it's not until we lose that mobility and that ability to do the things we want that all of a sudden we say, well, gosh, at any cost, I want to be able to regain this. And so that's our objective. That's our goal. I tell my patients, I don't want to give you a little bit of relief. We want to change your life. We want to make it so that as long as you're here, you're able to ambulate and do the things that you enjoy to do until it's no longer physically possible.
Well, Mike, let me ask you, what if someone doesn't have bone on bone, but they tripped, they fell, they hurt their knee, and I don't know what that even means. So is this something that you can help them with also? Is it, I don't know.
I think at times we can. I'll give you an example. We saw a young woman who really did not have any type of knee degeneration yet. And she had suffered a few spells where she lost consciousness. And when she lost consciousness, she fell and it hurt her knees. And there wasn't a lot that she could have done to prevent it. She was able to go to her neurologist. She fixed what was happening in the brain, causing these episodic losses of consciousness. So she's no longer having that problem. And she came into our office because she didn't want to have any more drugs in her system. She's taking medication to help regulate her brain, and they wanted a non-surgical option. This person, obviously a young person, responded very, very well to us and to our treatment, and we're happy to report she's doing great. However, let me clarify that if you have a brand new injury, something that happened a week ago, you tripped, you fell, you may have torn something or fractured something, well, then go see either your primary doctor or go see an orthopedist and make sure that they provide the most effective initial medical assessment first. If you have a torn ligament, if you're looking for minor surgical repair, that's not our wheelhouse. We specialize in the treatment of non-surgical chronic knee pain, non-surgical chronic tree pain. Non-surgical chronic, forgive me, chronic knee pain. And so what that means is if something started last week, we're probably not good as your first stop. Go see your primary, go see an orthopedist, have them do an evaluation, and then you can go from there. But for people that have been dealing with a problem for, I would say, a month or longer, a month to 10 or 20 years, I think that you deserve to feel great. And I think that it's probably worth the $47 to come in and have an evaluation and find out whether or not this treatment is right for you.
How long does the evaluation take?
The evaluation takes about 45 minutes. That includes our x-rays, that includes our history, that includes the test treatment and everything else. And if the person is a good candidate, we'll sit down and we'll try and put together a recommended care plan within 48 hours.
That $47 is like $1 a minute. That's amazing. I want to show everybody, this is what you're looking at. You're going to be getting that in Boomer Times. We're going to send a shout out. If you want this, you can just give them a call and they'll send something to you so you can read it. It's 954-977-0888. We're very, very thrilled to have this in our magazine. People know me enough to know as a gerontologist, I try to find things that are going to be the best for our elder population. And for those tennis players, I'm thinking of you. So many of you have hurt hips and knees, and you put off surgery, and as you age, it's worse. Why don't you go see Mike if you're having a problem with your knees? Because listen, you might be able to get back on a tennis court.
Yeah, that's exactly right. The 5 most dangerous words, when I used to go to school, I had a professor that said, the 5 most dangerous words are, maybe it will go away. Problems don't
Maybe
just
it
go
will
away
go
on their own.
away.
Yeah, problems don't just go away on their own. We have to take action. If we're not feeling great, as I said earlier, we believe everybody deserves to feel great. If you're not feeling great, it's your responsibility to do something about it. Not just for you, but for your family, your loved ones, your friends, the people that want you around. To sit at home and to hope and that something's just going to by itself get better. It's not the direction that our bodies go. As you well know, our bodies have began a decline process, and we can't control the decline, but we can control the angle. Some of us age very, very slowly and gracefully, while others kind of throw in the towel and have a steep descent. And so I always tell people the decision is up to you. You have the responsibility of good stewardship over your health, what you eat, what you watch, what you listen to, how you rest, what activities you do, all of these things, really, you're in control of your health. And so I encourage anybody that might be thinking, well, I'm not sure. That's just simply
Maybe
not a
it'll
good
go
response.
away, right?
Yeah, maybe it will go away. I don't think these things don't have a tendency to just go away. If they did, then if you wait for a week or two, you'd feel better. But I find that most people with chronic problems, if you wait a week or two, it feels worse. So taking action, whether it's with us or anybody, really, I do feel that it is important. For sometimes people, you can sit at home and be so burdened by the way you feel that lack of action or not taking action is a bad action. So do something, because nobody's going to knock on your door tonight and say, hi, I'm here to help you with all your ailments. It becomes our responsibility to take good care of our health.
Well, Mike Rozenblum, you're a peach. I want to just say that for you to be able to do this, I ought to get a t-shirt that says, do you have pain in your knees? But thank you for sharing.
I think we can do that. I think there's got to be a way we could get you a t-shirt.
Thank you very much. We appreciate you doing this with us. Now get back to all the lucky patients. Please do call him. Don't suffer. If you tell me you have pain in your knees and you haven't called Mike, I'm going to turn around and just walk away because that's silly. Thank you, Mike. We'll be back talking to you again.
Take care, guys. God bless you. Bye-bye.